Question. A 62-year-old male presents with a chronic cough producing frothy sputum, progressively worsening dyspnea, and orthopnea. On physical examination, you note bilateral basal crackles, an elevated jugular venous pressure, JVP, and mild pitting edema in both lower extremities. Chest X-ray reveals pulmonary vascular congestion and cardiomegaly. Echocardiography shows an ejection fraction, EF, of 35%. What is the most likely underlying condition? A. Chronic obstructive pulmonary disease, COPD. B. Left-sided heart failure. C. Pulmonary embolism. D. Acute respiratory distress syndrome, ARDS. E. COR pulmonale. Correct answer is B. Left-sided heart failure. This patient's symptoms and findings are consistent with left-sided heart failure, also called congestive heart failure. Key features include dyspnea, orthopnea, pulmonary congestion, as seen on chest X-ray, and reduced ejection fraction, systolic dysfunction. Key findings in left-sided heart failure. Pulmonary symptoms. Dyspnea due to pulmonary venous congestion. Orthopnea, worsening dyspnea when lying flat, is caused by redistribution of blood to the pulmonary circulation in the supine position. Physical exam. Basal crackles indicate pulmonary edema. Elevated JVP and peripheral edema suggest progression to combined left and right-sided heart failure. Imaging and diagnostic findings. Cardiomegaly and pulmonary vascular congestion on chest X-ray. Reduced EF, less than 40%, on echocardiography indicates systolic dysfunction. Incorrect options. A. COPD, causes chronic cough and dyspnea but lacks features such as pulmonary edema, reduced EF, or crackles. Instead, wheezing and hyperinflated lungs are seen. C. Pulmonary embolism, acute onset of dyspnea with pleuritic chest pain and possibly hemoptysis. It is less likely with chronic symptoms. D. ARDS, occurs in critically ill patients with acute respiratory failure and diffuse bilateral infiltrates on chest X-ray, not cardiomegaly. E. COR pulmonale, refers to right-sided heart failure secondary to pulmonary hypertension, often due to chronic lung disease.